Hello, people. Thank you so very much for joining me once again. So, for some time now, we've been talking about fasting. And this is a very apt topic at a time like this because millions and millions of traditional Christians, I must say, are fasting, observing what is known as the Lent period. And Muslims are also observing the Ramadan period. Again, these are fasting period for two major religions of the world. That means millions and millions of people are fasting at about now. I know Protestant Christians, some do not observe this, but they have their own practice of fasting, which happens regularly. So this is a very good time to talk about fasting. And on this channel, where we are dedicated to helping your spiritual life grow, we have been posting a lot of messages about fasting. And there's no way you are going to talk about fasting without talking about your health. Fasting has to do with your health. Fasting impacts your health. And as a matter of fact, there are two classes of people when it comes to fasting. Those who like fasting and those who are afraid of fasting. Some people are afraid. Some people are like, if I fast, I'm going to die. Now, I'm not an expert in that area. So I've decided to bring an expert today, someone who has gone to school, has studied a lot. My guest today holds a Bachelor of Medicine, Bachelor of Surgery, MBBS, degree from Ladoke Akintola University of Technology, Ogbomoso, Nigeria. She is a member of the Royal College of Pediatrics and Child Health in the UK, and she currently works as a pediatrics trainee within the National Health Service, NHS, United Kingdom. I'm so excited to welcome to the show today, Dr. Adebukola Olanrewaju. Doctor, you are welcome to the show today.
Thank you so much, sir. Actually an honor to be here today to speak and enlighten people about their health.
Thank you very much. I'm excited to join you also. I know you on a personal level, and I'm so happy that we have someone who brings a balance of two areas. You are a doctor, which means you know a lot about health and our body, and you are a Christian, you're a child of God, so you know about fasting. I believe you do fast. So let's start from there. What does fasting mean to you personally?
So personally, fasting is an intentional abstinence from food for a purpose. Okay. So I mentioned the word intentional. I mentioned the word purpose also, and abstinence from food. Yeah. So for me personally, I believe that fasting should be intentional. So that you've not eaten for a long time, and then you realize you've not eaten for a long time and said, oh, I'll convert it to fast. For me, that's not fasting. So it has to be intentional, and it has to be for a purpose. So many people can fast for medical reason and for spiritual reason. So that is fasting to help you concentrate on God, to help you move away from every distraction and focus your attention on God. And then some people do fast for medical reasons. Like sometimes when we have a particular blood test that we want to do, sometimes we like it fasted. So that's why I said fasting must be intentional and for a purpose.
Okay, fantastic. That's very good. And I like to say this way that fasting without prayer equals hunger strike. So that is fasting that is biblical has to have at the back of it, the purpose, to use your word, has to be to know God more. It could be, I want to read the Bible. It could be, I want to pray more. So fasting is not something that stays on its own. Biblical fasting is not isolated away from spiritual practice. I like your definition. It has to be with a purpose, and that purpose has to be a spiritual intention. I want to hear God more. I want to know God more. I want to pray about a particular problem. But today we are focusing on biblical fasting. And I brought you here because, like I said, there are people who love fasting. Maybe they've gotten the benefit of spiritual fasting. And there are people who are afraid. So what advice do you have for someone who says, listen, I've heard a lot about fasting. I would love to fast, but I'm afraid. I think I will die. But by 12 o'clock, I'm seeing my grandmother who died 3 years ago. What advice do you have for such a person?
Okay, so my advice for people like that is, the first thing is, do they know the benefit of fasting? Sometimes when you don't understand the benefit of fasting, then sometimes you might tend to not do it, and then sometimes you might be afraid and just give it up. So the benefit of fasting, we have the spiritual benefit and then the medical benefit.
Correct.
So for the spiritual benefits, which I'm not going to dwell in today, is when you want to move closer to God and read your Bible like you have mentioned. But I'm not going to dwell into that today. But for the medical benefit of fasting, now fasting does a lot of things. Firstly, it gives your stomach a break, and the digestion receives like a break. Fasting also can help you to burn fats. How do I mean? Now, what the body does when we are fasting is that it utilizes, we call something the bad cholesterol, the triglyceride, the LDH, the bad cholesterol. So it utilizes that instead to give us energy. And it helps to preserve the healthy fats in our body, which is necessary for the metabolism of our body. So in short, with the bad fats getting utilized, we have less heart problem. What do I mean by that? Some of those bad fats can clog into the blood vessel, that is the tube that is carrying blood to our body. And when they clot, they form like an obstacle to blood passing freely, and they can cause hypertension and then later lead to stroke. So fasting can help us with our heart health. So I'll tell the people, I'll go into the benefits, more of the benefits, maybe as we go on in our talk. But I'll tell people that want to fast but afraid, is fasting has a lot of benefits. Look into that. And if you're afraid, just, I think, learn in your heart that I am doing this for a purpose. I am doing this for a particular reason. So that fear should kind of diminish. But if you're still afraid, then look for scripture. I'm a Christian. Look for scriptures on fear. Sometimes we are afraid to try things. And then you don't have to start fasting for a long period of time, like, oh, you're going to die. You can introduce your body gradually to fasting. Start from 6 hours, gradually increase it in time, 8 hours, 12 hours, and gradually your body our body is so marvelous, because once we start introducing our body little by little to these things, it's kind of accommodated, and then we get used to it. So introduce your body gradually to it, and that will remove the fear of you or maybe collapsing or dying, except you have a medical condition. That is when you should seek your medical advice.
Okay, let's pause there. You have said a lot within this short period of time. So I like one word you said. You said fasting gives our body a break. I would like you to talk more about that, because you gave an impression that this body is like a machine that continuously works and works and works. So tell me more about the body needing a break.
Okay. So our body is constantly working. I would now, the food we eat in our body, it serves as a fuel. I'll make an illustration with a car.
Yes.
Now, a car is our body. And what we need to push that car to move it is the fuel. Now, that fuel in our body is the glucose, or the food we eat.
Yes.
So when we have that food that is a fuel in our body, it helps us it moves the car. So it helps our body to move. But sometimes when you're continually using a car without a brake, everyone knows that it can malfunction.
Yes.
And that is why sometimes when you continually work tirelessly without resting, your body can break down. So also, when sometimes we keep eating, our digestive system keep working, but sometimes it requires a break just to process things and to repair itself. So our body actually needs a break from the constant digestion. It gives it, when you have a break, it gives it that rhythm, that it sets the pace. So the body thinks, oh, okay, I need a break. How can I make myself better?
Mm-hmm.
For some reason, the body does that. Also, I would say that fasting also, in terms of the break we are talking about, it helps to clean up that break. It helps to clean up and kind of recycle all the damaged parts and the degenerated parts. So what do I mean? When your body do not have the nutrients, so when the cell don't have the nutrients, when they don't see it, they start utilizing the damaged parts, the damaged parts of our cells, the damaged part of our nutrients. They start recycling it, like a cleanup and recycling process occurs during fasting. So the body can utilize, like, yes, the old things and some things that are not necessary that are stored in our body. Just because we eat different kind of food. So the things that are stored in our body that are not necessary or that are not in use, at that moment of break or fast, our body then utilizes it into things that are meaningful, that will help our body. So it kind of recycles our body and clean it up when we fast.
Yeah, very, very interesting. Thank you for all the insights. It's quite insightful to know that, one, the body needs break. I know we get the break from sleep. When we sleep, okay, I walk, I go to bed, the body rests. But not many people know what you just said now, which is eating itself gives work to the body to do, because the body has to digest it. So it's something that may be new to somebody who thinks that, okay, I'm enjoying and I can continue to pump my body with food even at 12 midnight, then 4 a.m. I wake up again, I eat another one, by 8 a.m. I eat, 12 noon I eat. Not many people know that you are giving the body a lot of work to do because it has to continue to digest. As a matter of fact, some people follow a regimen similar to what I just said, that before the food I took at 7 a.m. digests, I've started to pump it by, let's say, 10 a.m. with another food. And then by 12 p.m., there's another food. And the earlier ones have not even fully digested. So I'm learning that from you, that giving space and things like fasting helps the body to actually detoxify itself. You probably did not use that word, but that's what I get from it. Clean old cells, blood vessels. It's actually interesting again to know that it helps early aging. I don't want to grow old, so that means I have a lot of more fasting to do. All right. So let's talk about this fasting slowly. Again, I'm focusing on the gentleman or the woman who says, look, fasting is not for me because I'm afraid. You did say that somebody can start by fasting gradually. Not many people know this. And this is why people who love fasting love it, because they have the strength, they have the energy. Perhaps they are trained for it. But there are people that they are not necessarily trained. People even believe that fasting has to be from 12 to 12. Can you speak to that, or there's no regimen to fasting?
Personally, I believe there is no regimen to fasting.
Yes.
Everybody is different. My body is different from another person's body. Mm-hmm. And that is why during fasting, you have to know your body. So my body might have been used or can withstand prolonged period of not eating. Why some people, if they try that and for the first time go on a 12-hour fast, they might have headaches, they might have dizziness, because they're actually metabolizing. That means they are using their metabolism is fast. I'll explain that. What I mean by their metabolism is fast is they've used all the glucose reserve, they're using all the fat, and they have less things available to use as fuel. So know your body. And like I mentioned earlier, that there's no perfect regimen to fasting. You can start small and then build it up. Our body is unique and fantastic that it can accommodate things that we slowly introduce to it. So you can start from a small fast. And my definition of fasting initially is intention and purpose. So you don't have to copy everyone around you doing it. What is the purpose? Is it to tell people, oh, I made this 12 hours fast? Purpose, you want to use that time to concentrate on God or for a particular purpose. So it doesn't matter the length of time. Introduce your body gradually. Check how it is for 6 hours. Oh, I'm able to do it. Fantastic. Try to stretch it with 2 hours. Oh, 8 hours. Fantastic. And over time, you just find yourself that you can do more longer time. So know your body. It is actually very important. And there is no specific regimen that you must fast a particular amount of time for it to be counted as fasting.
Thank you. That's very amazing. And I think this is one area where we as the church, and I'm speaking from the Christian perspective, if there are viewers who are not Christian, we don't emphasize this enough. Let me give you an example. When churches declare fast, I've had people say, we're going to fast from 6 p.m. till tomorrow 6 p.m. I think that's too much of a generalization. If I were to pastor a church, I will allow people to fast at their own pace. I will not emphasize 6 to 6, okay? Or, which we are going to talk about later, I will not emphasize dry fasting. These are the things I've seen in Christendom, especially in our climate in Africa. So we should let people do it at their own pace. Again, if you are hearing and watching us, and you are afraid of fasting, and you are conscious of the benefits of fasting, please do not test the water with both feet. That's not wise. As the doctor has said, know your body. Start small. Maybe you skip a breakfast, you eat in the afternoon. That is still fasting. Please don't believe that lie that is not fasting. That is still fasting, especially if you use it very well and combine it with your intentional purpose of seeking God. In my personal opinion, I will rate somebody higher who fasts from morning till, let's say, 2 p.m. And out of that 2 p.m. is praying, is reading the Bible, than somebody who does a 12-hour fast and is probably not, is just going with willpower and he doesn't have power to pray, or is not doing the intentional seeking of God. So having established that fact, let's go to a point. So are you saying categorically that from a physiological standpoint, fasting is safe and beneficial?
I would say fasting is safe and beneficial when practiced the right way. So the safety of fasting depends on the duration for each individual, the individual health status, and proper hydration. That means when you hydrate your body properly. Those are the things that influence the safety of fasting.
Can you say that again, please? What influences the safety of fasting?
Okay, so I would say that the things that influence the safety of fasting depends on the duration. That is the duration of the fast, because everyone is different. The individual health status, that means your health status, and then your proper hydration. Those three things determines the safety of fasting.
Okay, I think we should unpack those 3 points. The duration of fasting, the individual health status, and hydration. That is big. Let's unpack it a little bit. What duration of fast do you consider as safe, considering science, that's physiology, and Bible? Can you speak to that?
Okay, so for duration of fast, I think we've mentioned it earlier on. Listen to your body. Know who you are. Let's avoid, listen to your body. So if you know that you're just starting out, start small and then gradually increase. We have people that are fasted for long days, like breaking intermittent in between, like for a long time, but breaking their fasts for long days. Like the Muslim fast for, is it 30 days, but they break their fast for those time. So people can have that period of time. Oh, I want to fast for this amount of day, but with breaks in between. So know your body. So fasting, the safety of fasting depends on the duration for you. For you, do not over push your body to the limits. Body is saying no. So that is for the duration of fasting. Like I mentioned, there's no specific duration that I will say this is an accurate fast. Going to your health status. Everyone must know their health status. For example, some pregnant women. So pregnancy, you are actually, people say, oh, you are eating for yourself and the baby, because the baby also requires nutrients. So knowing that, oh, this is I'm pregnant at this time, I need nutrition. So I would not expect a pregnant woman to go into a prolonged period of fast. Yes, sometimes you can say, oh, you want to skip breakfast. That's fine. And then eat later. But as a pregnant woman, your baby needs adequate nutrition. So no times and seasons. There are times and seasons to fast. You can always fast when you've given birth, after breastfeeding period. You can always fast every other time, and you can communicate to God. So that's for pregnant women. Also, there are some people with some medical condition. I would say, for example, some people with diabetes mellitus, especially the type 2 diabetes mellitus. Those are, everybody knows diabetes. So they are on some medication. Those medications are to help them utilize this glucose. So using that medication, you are utilizing your glucose and you are not even having anything to eat to bring in glucose. Is quite dangerous, because that medication alone can lower your blood sugar, and you not having anything to eat can further lower it, which is very dangerous. And it might not only be diabetes patients, any medication. So if you're on any medication, please contact your doctor, seek advice to when you want to start fasting, because there are some medications that actually brings down our blood glucose. So seek medical advice if you are on any medication before you fast. Proper hydration is very important. Like I say, most people don't know that our body is composed of mainly water. Like 50 to 65% of our body is water. And that water, the brain takes around like 73%, the lungs like 83% of the water. The blood also needs water. So you not hydrating, you can lead yourself into dehydration. And dehydration is very, very dangerous. Now, let me explain by what I mean by dehydration being dangerous. Now, when you are dehydrated, it can affect your blood pressure. So, because your blood, it's moving to the troop, that's the blood vessel, it's constantly flowing. But when you are dehydrated, what happens when a fluid is less? your blood thickens, and then it finds it hard to go through that blood vessels. And because it's finding it hard, there's fluctuation in your blood pressure, because your blood pressure deals with the pressure of blood in the tube. And then it can lead to either low blood pressure, which is dangerous. It can lead to cardiac arrest, or high blood pressure, because your body is trying to compensate for it. So I mentioned that your blood thickens when you are dehydrated. So because your blood thickens, your body wants to kind of push this blood, because your brain needs blood, your heart needs blood, your lungs need, your whole system needs blood. So what the body does is it tries to constrict that blood vessel, just to push that blood. It constrict it and force the heart to work harder than it should, which is dangerous.
Okay, now there's a lot said about that. Unfortunately, this program is envisioned to be within 20 to 30 minutes max. So what I would like us to do is to pause here, get a recap of what we've said, and then in the next episode, we will continue, because there's so much that we need to learn about fasting, especially from the perspective of our body and our health. So today we've established the fact that fasting must be intentional. Fasting could be for health purposes, medically, or from a spiritual perspective. And if it's a spiritual perspective, then you need to add, on top of doing away with food, you need to add intentionality of seeking God with prayer, Bible, and every other spiritual activity. We've learned that if you want to start, you need to know your body. You need to start small. You may need to start small and grow and grow. So don't just jump. Nothing, I believe, works like that. Once I went to a gym, I was carrying a lot of loads, and the next day I was working like a zombie, because I moved from 0 to 100. It doesn't work like that. We've learned a lot, to be honest with you. And at this point, I want to wrap up. We learned the fact that for a fast to be safe, we need to look at it from the duration. We need to look at it from the individual's health status. Like someone who is pregnant, you don't need to fast. 9 months without fast will not kill you. And somebody who has a medical condition, you don't need to fast. I mean, medical conditions like ulcer, like diabetes. And we talked about hydration. I would like to pause here. When we go to the next episode, we will start from there and we will build. I must say a very big thank you to you, Doctor. I'm going to bring you up again next episode. But for now, thank you so very much for giving this time to us. Maybe you want to say a final word before we wrap up this particular episode.
Okay, so thank you so much for this opportunity. And like you've mentioned, make sure you fast with intention and purpose, and know yourself. Thank you.
Absolutely. Thank you so very much. All right. So we're going to see you next episode. Until then, make sure you fast safe. God bless you. Bye.
Okay, bye.